Hey amigos, welcome back to our Wikivet channel. Here we cover veterinary related topics.
Hey, what happened to your cow?
My cow's udder has been swollen and on milking milk coming flakes. Please treat my cow, doctor.
Okay, this condition called mastitis. Mastitis is the inflammation of the mammary gland, which can result from several different types of pathogens. The different types of mastitis are clinical, subclinical, chronic, and acute mastitis. Each of these types presents different symptoms and requires different treatment.
How this can happen, sir?
Predisposing factors like mechanical trauma, thermal trauma, chemical insult causes entry of pathogens.
Etiology, also called causes, may be one of these pathogens or mixed infection. In India, Staphylococcus aureus and pigeons have been isolated from large number of mastitis cases. In some herds, on the other hand, gram-negative organisms, E. coli and Aerobacter have been isolated.
Pathogenesis. Milk being a good medium for the growth of bacteria infection is much more serious in a lactating udder than in a dry one. The acute systemic symptoms are due to the action of the bacterial toxins that diffuse into the general circulation. The development of mastitis can be described under three phases. The invasion phase, in which the bacteria are able to enter the teat orifice and be present in the teat canal and cistern. The infection phase, in which the organisms are able to overcome the resistance and multiply. The inflammatory phase, in which the organisms invade the udder. Types of mastitis. Clinical mastitis is the most common and dramatic type of mastitis. It occurs when you observe visible symptoms like swollen udders, a high body temperature, an abnormal milk color, and sometimes clotted milk. This type of mastitis must be treated fast and efficiently to avoid further damage to the cow. Treatment usually involves antibiotics and anti-inflammatory drugs, as well as administering an intramammary infusion. Then, how to detect and differentiate the mastitis, doctor? Diagnosis of mastitis is done in two places. First is done on farm testing, California mastitis test, somatic cell count, SFMT, milk pH, modified white cell test, etc. Second is done in laboratory tests, bacterial culture gel electrophoresis, PCR, etc. So then, how can you give treatment, doctor, sir? Treatment can be based on etiology diagnosed in tests. There are two approaches of treatment. One is conventional therapy or cold applications, NSAIDs, antibiotics, dry cow therapy. Second is new therapeutic strategies or nanoparticles, cytokines, vaccines, bacteriophage, antibiotics. Treatment based on antibiotic sensitivity tests report. That's it for today's video. If you found this video helpful, please remember to give it a thumbs up and subscribe to our channel for more informative content. Thank you for watching.